Hi, I'm Betsy Calvert, and this is my professional practice model presentation. What is a professional practice model? It's a framework that supports professional nursing practice. It guides nurses to practice to their full potential. It symbolizes beliefs, values, theories, and systems for nursing practice. It defines the components of nursing practice. Professional practice models consist of values, professional relationships, a patient care delivery model, a management approach, and compensation and rewards. How do professional practice models help our patients? They enhance the quality of patient care, they enhance the competence of the nursing staff, pays attention to the cultural and ethnic diversity of patients, families, and healthcare providers, and it supports excellence in nursing management, philosophy, and practice. Riverside Regional Medical Center has been serving the community since 1916. They were on 50th Street and Huntington Avenue in Newport News, Virginia. In 1963, they moved to the present location on J. Clyde Morris Boulevard, which is a 72-acre location that is just under 300 beds. And we are a level 2 medical trauma facility. The range of on site testing includes MRI, CT, PET scans, ultrasounds, nuclear medicine, EKG, cardiac testing, and digital mammography. We are an acute care facility. However, we do have other facilities that are long term care and also preventative maintenance, like your doctor's offices. We also have our mission, which is to care for the others as though we would care for those we love, to enhance their well being and improve their health. Their values are nurse autonomy, nurse accountability, professional development, and emphasis on high quality care. Professional relationships within Riverside, there are concepts of teamwork and collaboration and consultation. This can be inpatient or outpatient. And we also have teams, IPOC meetings where all of their team members get together and we discuss the best patient care for that patient. This includes physical therapists, occupational therapy, dietitians, the physicians are on board. Um, we also talk to pharmacy for them. We um, get all of their medications together. We have an inpatient and we also have an outpatient pharmacy. So, as a convenience for the patient, we can fill the patient's prescriptions before they leave the hospital, and that's one less worry on them. Our patient care delivery model includes primary nursing. We have, since we are a 24-hour hospital, there may be some nurses that are not on for the next day. So we do thorough handoffs to them so that that way nothing gets missed with the patient. If the nurse is back the next day, we do assign those nurses to that patient so that that way the continuum of care is given. We also have case management delivery systems. We have discharge coordinators so that that way the patient can not only get care in the hospital, but they can have their needs met outside when they go home. If they need a wheelchair, if they need a walker, oxygen tanks. We set up appointments for them for follow-ups at their for their physicians so that that way they get the best care possible. We also have a management approach. So that expands the scope and the type of unit nurse manager responsibilities. It also institutes structural changes to support professional practice. We just had a job fair so that that way we could get new employees in to join our team. And the unit nurse manager oversees the daily care of the nurses. She's an invaluable resource for them when they're making their judgments. Um, if something happens on the unit, she is our go to person. And the structural changes, they're making different um, changes so that that way you can come in and you can have different um, different career leading positions available so that that way the patient gets taken care of. Compensation and rewards, they recognize professional achievement. Um, they recognize contributions towards the organizational goals. Professional achievement, they have educational reimbursement programs that employees can get. Um, and then also they have patient survey satisfaction surveys so that that way the patient can recognize nurses and other team members that if they have gone above and beyond to do great work. And we've actually had 3 people on our unit to be nominated for the Daisy Award this month, so that was fantastic. And Riverside believes in the QSIN, which is quality and safety education for nurses. So they believe in patient centered care, teamwork and collaboration, evidence based practice, quality improvement, safety, and informatics. So the number one goal is to keep the patient safe. We've also tried to include them in their care to see what things are important to them. We get a Again, we get the IPOC, so we have the teamwork and collaboration. We also have different ways that we can stop a procedure. We call it a timeout. We can stop a surgery so that that way we make sure that everybody's on the same page. We also do evidence-based practice. So we have different, our fall risk scores. We decide what interventions we need for the patients for the best care. Our catheter insertions are based on evidence based practice. All of our infection control procedures are also based on the evidence based practice. Quality improvement. If we find that there is something that actually can improve the way that we're doing things, we've come up with over the years a number of electronic health records, and so we have improved a lot on that. The patient safety is always the first priority. So there's lots of programs in place that take care of that. And then the informatics. So like we have different computer sessions based on the program that we're using for the facility at that time.